Good evening, and thank you for joining us. The Thunder Bay District Health Unit confirmed 4 new cases of COVID-19 today. 3 are from First Nations and 1 from the Thunder Bay area. There are now 55 total cases in the district, although 37 of those people have since recovered. Meanwhile, Thunder Bay Mayor Bill Morrow says he's considering declaring a local state of emergency over COVID-19. That came out of last night's virtual town hall meeting, which he participated in alongside Medical Officer of Health Dr. Janet DeMille. If a state of emergency is declared, it wouldn't be because the virus is about to overrun the community, but because it would give the city greater flexibility to redeploy its employees. Ryan Benazzo explains.
During Tuesday evening's virtual town hall meeting, Mayor Bill Morrow was asked why he hasn't yet declared a state of emergency, as many other municipal leaders across the province have.
Thanks for the question.
While he acknowledged there's a symbolic benefit to such a declaration, Morrow said until very recently, it wouldn't have helped a whole lot in the city's fight against COVID-19. But now, under Ontario's Emergency Management and Civil Protection Act, municipalities that do declare a state of emergency are granted greater flexibility when it comes to redeploying employees into essential positions.
Management in the City of Thunder Bay would have authority to redeploy staff, notwithstanding whatever collective bargaining agreements may be in place. It would not be a power, obviously, that management would use ruthlessly.
But it is a power he is now considering exercising.
Through conversation with the bargaining agents, you would have to give them a notice before you did some of this work. You would have to have people trained properly in the areas that they were redeployed to. You could not move to an area that paid you less than the job you were being moved out from.
Morrow says he'll make that decision soon. Throughout this pandemic, Thunder Bay has been a week or two behind Southern Ontario in feeling the effects of the coronavirus. Residents here in the Northwest have long complained about Toronto-centric decisions made at Queen's Park. But when asked about that as it relates to provincial measures on COVID-19, Medical Officer of Health Dr. Janet DeMille responded by saying in this case, that was a good thing for Thunder Bay.
The measures were put in place, perhaps even before they were really needed. But that's when you want to put these kinds of measures. So when you talk about closing things or reducing gatherings, closing schools, closing the businesses, the issues around the recreation facilities, for example, all the other things that we've seen, I think we've benefited from them in reducing the spread of the virus that is here.
But that doesn't mean we can ease physical distancing measures anytime soon. The pair say large summer events like Canada Day festivities at the marina are becoming less and less likely to go ahead. Ryan Benazzo, TBT News.
Mayor Bill Morrow is confirming he's faced some pressure from local groups and individuals to begin the process of reopening services here in Thunder Bay. But he says at this point, the vast majority of those facilities that people want reopened are provincially mandated.
Starting to look for an easing of certain restrictions that impact on services and revenues and the like. I saw a councillor in Kingston a couple of days ago was moving a resolution asking the province to ease restrictions. I think for me it's important to remind the community that most of what impacts revenues, most of what impacts the economy and business is controlled by provincial orders. And so the emergency declaration as it stands right now has been extended till May 12th. And at that time, we'll see if the province makes a decision to ease any of the restrictions that are currently in place. That is the mechanism through which we would see an easing on economic restrictions and potentially some recovery in the economy of Thunder Bay.
Ontario Premier Doug Ford is asking the federal government for military assistance at 5 long-term care homes hard hit by COVID-19. This follows the deployment of armed forces medical personnel in the Montreal area earlier this week. Ford says he's looking for operational and logistical support that will allow staff at the homes to focus on the care of residents. Colin DeMello reports.
The death toll inside Ontario's long-term care homes is mounting. COVID-19 has taken the lives of 447 residents and 1 employee. The Premier calls it a raging battle that now requires reinforcements.
This includes resources from Public Health Agency of Canada and Canadian Forces personnel.
Members of the Canadian Armed Forces have been assembling at CFB Borden near Barrie since early April, just in case they were called in to assist. The Premier says the province is asking for enough soldiers to help 5 long-term care facilities around the clock.
So staff can focus on the care of the residents. They will assist with operations, coordination, or medical care, logistics, and general assistance.
And while the province has counted outbreaks in at least 127 long-term care homes, the military will be deployed to only 5 priority residences.
Well, things change very quickly, sometimes hour by hour. That military assistance will go to the homes that are in greatest need.
As the province tries to clamp down on COVID-19 in long-term care, it also took another dramatic step today to understand how prevalent the problem actually is. Every single resident and staff in every single facility will now be tested for the virus, whether they have symptoms or not.
Just to make sure we're not missing it, and we have to expand our surveillance even further.
So far, the province has only been testing long-term care residents if they have come in contact with a confirmed carrier of the virus. More than 11,000 residents and staff have been tested to date. It's less than 10% of the total amount. If you think that number seems to be low, Premier Doug Ford agrees.
I was shouting and screaming 2 weeks ago, we need more tests. There was no one out there that was beating the drum louder than I was.
But the Premier suggested today that his hands are tied, that he doesn't actually have final say.
As much as people may think I can jump in there and overturn what the chief medical officer says, I can't. He has powers that I don't have.
The chief medical officer of health says he simply provides advice to the Premier.
I would think it's just that the Premier is definitely wants to get this moving, wants to get it over with, would like to decrease the deaths as quickly as possible.
Ford says, however, there are cracks in the system and he is frustrated.
Yeah, I think we should change a lot of things after this pandemic.
A sign of the strain of fighting a fast-moving virus.
As we mentioned earlier, the Thunder Bay District has 4 new confirmed COVID-19 cases. 2 of those people are now in hospital at Thunder Bay Regional, and that brings the total number of local hospitalized cases to 5. Today, Cole Promain spoke with the COVID-19 incident manager about the situation.
At the present time, we have 5 admitted patients with COVID-19.
2 of those patients have been in the ICU for some time. A man and a woman in their 50s in serious but stable condition. The other 3 are in the dedicated COVID-19 unit, including the 2 newest hospitalized cases, a Thunder Bay area woman in her 30s and a First Nations woman in her 40s. The other case, there is a man in his 70s. There are also 22 presumptive cases within the hospital. Dr. Stuart Kennedy, who is managing the COVID outbreak at the Thunder Bay Regional, says that they have been monitoring the differences closely.
One of the patients admitted yesterday has very minimal symptoms, but they came from our one of our special units, and we just thought we'd bring that person in to have to isolate them. We had a better ability to self-isolate than they did at home, so we brought that patient in. So minimal symptoms, but the other ones are still more the shortness of breath and the cough and the fever. Okay, and the ones in the ICU, of course, they're more serious.
This week, the hospital made it mandatory for outpatients and anyone else coming into the hospital to wear a mask.
We prefer that the visitors will actually bring their own masks in, okay, and the cloth masks are just as good and have them, so we'd have to use our supply, but certainly because masks are now mandatory, so we certainly want to make sure that we protect them from spreading to our healthcare workers. So again, we prefer people bring in their own mask, but if they don't, we'll have to be supplied them.
And the regional hospital continues to have enough supplies of N95 masks and other personal protective equipment for their staff. Kennedy credits that to the local citizens following their recommendations.
Yes, and that's the key, because the community has done such an outstanding job of their physical distancing. We haven't had the onslaught of patients coming in with COVID-19, so that's given us a chance to preserve the masks, preserve the gowns, and preserve sort of the all the PPE. So right now, as long as we maintain, as what we're doing here, and just getting a slow trickle of patients coming in, we have sufficient supply for months actually regarding the the supplies.
The hospital occupancy rate has jumped from 59% to 65%, but Kennedy says should there be a spike in COVID cases, they still have plenty of space for those who need it. Cole Promain, TBT News.
President of the Ontario Nurses Association is demanding answers regarding a privacy breach at the Thunder Bay Regional Hospital, which involved the personal records of hundreds of employees. According to a report last week by CBC News, the records of 245 staff members were published on the hospital website at the end of March. The data included names and social insurance numbers and reportedly remained on the website until early April. Regional hospital officials have turned down all requests for interviews about the situation. ONA President Vicky McKenna says she and her members here in Thunder Bay are not impressed with the way the breach has been handled by the hospital.
The privacy breach that occurred is very disturbing. The communication piece of it is been problematic, and that is a very big concern for us. That we don't even know yet at this point. As of this morning, I don't know, and our staff and leaders on the ground there haven't been assured that they have been notified as to who all privacy was breached. So that is a problem.
Hospital officials explained their refusal to comment by stating that their focus remains solely on the current pandemic. To that, McKenna says she understands, but she says COVID-19 doesn't exempt employers from doing everything they're obligated to do to protect their employees. After 4 days of virtual silence, the OPP have finally issued an update about that major police activity in the town of Nipissing last weekend. However, today's media release offers few details about the investigation into a missing woman case. 26-year-old Alyssa Turnbull from Gillies Township was last seen in Nipissing on March 23rd. She was reported missing on April 14th, and OPP announced her disappearance 2 days later. Then on Friday and Saturday, multiple police units began descending on the small community, and neighbors told TBT News that they were asking about a missing woman. OPP refused to comment, and speculation was rampant on social media. Today, the OPP confirmed a massive search for Turnbull involving members of their crime unit, forensic identification unit, emergency response team, underwater search and recovery unit, and a police helicopter. OPP say they're seeking the public's help in finding Turnbull and returning her home safely. The general manager of Thunder Bay's Bombardier plant says they began preparing for the COVID-19 pandemic months ago, and they're now ready to welcome over 400 workers back to the local plant. Dave Black says they've done everything in their power to make the workplace safe for the restart of production. Corey Nordstrom reports.
Back-to-work initiatives have taken form at Thunder Bay's Bombardier plant to practice social distancing and enhanced cleaning imposed by the company.
We have added on extra cleaning for our washrooms, our cafeteria, and even the tools. And we've designated walkways and directional walkways.
Designated points of entry and exit have been created, so workers will be forced to respect social distancing policies. Among the initiatives is an added focus on hand washing and the use of touchless water coolers. And they've accounted for areas where a 2-meter distance is unavoidable.
We have spread out the work teams. We have put on a second shift, so instead of just being a day shift like we have been, we've split the crew and they're going on 2 shifts. Whenever there is the instance that they have to work in close proximity with each other, we have PPE for them so that they will have face shields or masks, whatever they need to for the time that they're going to be working again in close area with each other.
It's been a gradual callback, with the majority of the 400-plus workers slated to be back at the plant on Monday. And they're making sure that none of those workers can enter the plant if they may have the virus.
So we have a pre-screening that we're doing right now before all employees come back, but then we have a daily check sheet that every employee has to turn in to say whether they've been exposed or whether they feel sick or whether they feel that they have any of the symptoms or whether they have somebody in their family or in their household that has that.
Black says they are prepared to address any new issues that arise with employees back on the factory floor. Corey Nordstrom, TBT News.
The message to stay home has been important in helping slow the spread of COVID-19. However, that directive can be problematic for people who don't have a home to stay at. Thunder Bay officials have been looking for places to help house people who are experiencing homelessness during the pandemic. Troy Charles has more.
In the early stages of the COVID crisis, the local healthcare community understood something needed to be done to help the most vulnerable members of society should they become ill. The Urban Abbey stepped up early on, agreeing to house a handful of homeless individuals suffering from non-COVID related illnesses. Meanwhile, the officials from St. Joseph's Care Group began working with other agencies to come up with a plan for an isolation shelter for homeless individuals who may have been exposed or are suffering from COVID-19.
And some of those requirements were the need for an individual bedroom with an individual bathroom, and a number of the hotels locally stepped up and said that they would be willing to serve in that capacity to provide a bank of hotel rooms.
Now, one hotel was eventually chosen to be the city's isolation shelter. The hotel, whose location is not being made public, has designated 20 rooms towards the shelter, and over the past 2 weeks, around 25 individuals have used its services. Cynthia Olson is the coordinator for Thunder Bay Drug Strategy, and she explains some of those services being provided at the isolation shelter.
So Grace Place staff provides 24-hour coverage. They're providing the supportive contact with individuals either through phone or through the door. Meals are provided to individuals, so that is part of the plan. People need to be able to be fed effectively.
In many instances, some were experiencing withdrawal symptoms, for example, from substances. Being in isolation is very, very difficult when one is not used to being, within four walls and staying put for a protracted period of time. And so we were able to, because we had the health services on site, we were able to respond to a wide range of healthcare issues and needs for the individuals who are in the isolation shelters.
The funding for the hotel rooms is being provided by the Thunder Bay DSAB. Troy Charles, TBT News.
With several weeks before planting season begins in Thunder Bay, Roots to Harvest and other supporters are pushing the Ford government to include community gardens as an essential service. Under the Emergency Management and Protection Act, community gardens are deemed non-essential, forcing them to be closed province-wide. Roots to Harvest operates 2 urban farms on top of the 9 other community gardens in Thunder Bay. Organizers say they're necessary for the health and well-being of hundreds in the city. Nearly 24 participants in the youth employment program at Roots to Harvest urban farms will be affected, plus the many jobs the seasonal gardens provide. Executive Director Aaron Beagle says the community will feel the effects if the gardens remain closed.
We don't have community gardens. People will feel that in their own food budgets, and you can really keep your space in a community garden. Like, you don't have to be side by side. You're almost never side by side anyway. And so they create connections even outside of just the gardening. They create neighborhood connections. And we need right now a community that cares for one another. We need a community that can, know who needs help and when they need it.
Beagle adds that both Quebec and BC have kept their community gardens open. An alliance of healthy food groups claims that provincial government departments have been meeting to discuss ways to safely exempt the gardens from the closure order.
Well, Fiona, the sun was out today, but unfortunately it wasn't working too hard because it wasn't very warm out.